Hi, my name is Dr. Leslie Blevins, and I own and work at Enilda Clinic. Parents and kids can expect a really warm, welcoming environment whenever they come to Enilda Clinic. From the very first contact, which is typically the parent calling me on the phone. And so I like to listen to the parent's concerns, understand what is the goal that that family has for their child, and do I have a skill set to meet that goal? If I do have the skill set, then what we do is we talk about how would I work with them? And I think this is the nice thing about working with me, is that the parent is always looped in. This isn't a clinic where the parents come in and they're sitting in the waiting room for an hour while I work with their child. That never happens. The parent is always in the treatment room. The parent is learning about child development. The parent is learning why certain symptoms or behaviors might be occurring for their child. They're learning about the environmental triggers that could be bringing about those certain symptoms. And then I'm helping the parent to know what they can do in the moment all week long to support their child, so that their child is getting more and more adaptive skills so that the symptoms start to diminish and their child starts to feel better. Whenever the family first comes in, my goal is always to make that child feel super, super comfortable. My office is designed to be very safe because oftentimes I'm working with children with developmental disabilities or very young children who might want to climb on my furniture or pull out every single toy and throw it. All of that is taken into account. And so I have safety locks on all of my different cabinets. The toys that I've chosen are very specific, one, to help me to understand certain symptoms that might be present for different populations, but also for safety. And I do switch in and out toys based on what the parent has told me on the phone and based on the age of the child. So every experience with a family is very uniquely about that child and helping that family. Every family will have a different experience here, and it's all designed to maximize and to make the therapeutic experience as efficient as possible. My therapy approach typically doesn't require a very long therapy duration, and so it tends to move very quickly. Parents are starting to see progress in their children within weeks, and then we're stabilizing the child and the difficult behaviors within a couple of months. Oftentimes we're thinning out therapy within several months, and then we're terminating therapy after a couple of months later. Sometimes it can feel like you're getting advice from 100 different people and none of the advice works. That is a big reason why I focus on evidence-based practice. The things that I do, they work. That's kind of the definition of evidence-based practice, is that it does work. And the point of my training is that I can tailor it to your situation so that it works for you. Whereas maybe the very well-intentioned moms on social media, they did things that worked for them and they were so excited, they just want the very best for you, but it's not necessarily true that what they did will work for you because you are in a very unique situation. And I think that's important to recognize, that you're not doing anything wrong. You're doing the best you can with the knowledge that you have, the skills that you have. Sometimes your child just needs a certain little technical tweak to the environment in order to get over a hurdle. Or maybe your child has a developmental delay, and so you're going to need that extra layer of therapeutic parenting skills, and that's okay. Accepting that and getting that support is recognizing that you're worth it. You don't need to have that stress in your life, right? There's so many things that we're willing to have coaches for and we're willing to get extra support for. And I really believe that parenting is one of those areas that we could get that extra support for and diminish the stress, diminish the shame, and feel better. And I really do think that the way that I practice, you can feel better relatively quickly. And so I think there's a lot of hope out there. It's just really being willing to accept that professional level of support where we're providing evidence-based practices that are targeted for you, that we can tweak them so that they work in your home with your child.